Welcome to Wimpole Street Dental Clinic. My name is Chris Jamel, and in the following small video we would like to show you how to clean around implants. Implants are not better than teeth, so they need to receive the same or even better care than your natural teeth. So we hope that you enjoy the video, and of course, should you have any questions around this topic, please give us a call. Thank you very much, and we hope you enjoy the video.
Let's go with the fourth part of our dental hygiene series of how to clean implant restorations. Nowadays implants are placed regularly around the world and is actually a great treatment, but of course implants need to clean as well, maybe even better as teeth, to keep them a long time. So there's a very important job for you to do in order to keep those implants. You have to brush really well. And how to do that we go through with this lecture. First we start with the single implant and the single implant restoration. That means a single crown on implant. You remember maybe this case from the third part of our dental hygiene series. This case you maybe did not think contains implants as well, and that's why I've taken an x-ray to show you. You see the lateral incisors and one of the molars contains implants. You go one step back, you won't really notice until you see the x-ray. And of course they need to be cleaned very properly, so I show you how to do that. Of course, first, electrical toothbrush or manual toothbrush is always the same. You clean properly, 45-degree angle, upper jaw inside, lower jaw inside, upper jaw outside, lower jaw outside, and then next step of course will be, as always, interdental brushes, cleaning the area in between the teeth. Make sure that the dental technician and the dentist leaves a little bit of space so you can brush, but this area underneath the gums of course remains unbrushed with the interdental brush. So what you need to do in some cases is use dental floss as well. Be very careful not to push it too deep, but clean a little bit underneath the gums, exactly like that, like this. But of course don't torture your gums, so make sure that you do it in the right way. So watch when you do it initially. Of course we have implants supporting removable dentures as well. In this case it's an upper jaw complete denture supported by 3 implants, and the lower jaw is a so-called telescopic denture. Very old, more than 15 years old, but still functioning. But you can see oral hygiene is not really perfect. The teeth are not 100% clean, so we went through it again, and this example I want to show you. So first, of course, you take out the denture in the upper jaw, clean the denture properly, put the denture to the side, and make sure if you clean it above the basin that you have like a towel in the basin, because in this instance a lot of denture fall down and crack, and if you have a towel in there they don't crack. Then of course you can see the implant supporting structure sticking out of the gums. This is called a locator. It's like a button of a jacket. This principle. One part of the button is in the denture, one part of the button is screwed to the implant, and then it clicks into position. And you can see these are nice and clean because the patient did that really well, what I'm going to show you now. So when you have these restorations, you really need to clean all around it and make sure that you don't have any bacteria, any buildup, anything there. So really watch and clean all the surfaces around that. Lower jaw, you can clean your teeth with a normal electric toothbrush, leave the denture in place. Then you go through with the interdental brush, actually leaving the denture in place so you have pressure on the neighboring teeth. You can use the electric toothbrush as we discussed in a 45-degree angle. And then of course you have to clean your denture properly. You can use toothpaste, or you can washing up liquid, and really make sure you clean all the surfaces, clean the connecting elements as well, that there are no food rests in there, which sometimes can happen, no buildup, no calculus, that the dentures are really cleaned well, and that makes them last a long time. If you want, you know that there are these tablets which can be used to clean them additionally. Don't use these tablets longer than 50 minutes. If you do it longer and leave it overnight, it destroys the gingival part, the resin part of these dentures. They become porous and they stain even faster and even more. So 15 minutes in these, for example, cookie dent or whatever dental cleaners you have, 15 minutes, not longer. Of course, clean everywhere, clean in between the teeth, like exactly like you would clean your teeth if they were still in the mouth. So really clean your teeth properly and make sure that all surfaces are cleaned, including the lingual wire underneath your tongue. So teeth are clean, dentures are clean, implants are clean. You can see here an example of implant support, very old denture, still working, but you can see the white bits here. These are bacteria, they need to come out. Okay, so keep your denture clean, so the risk of any infections or any fungal infection is very low if you keep your dentures clean. Good. If you have a screw retained implant bridge, shown here in this situation, it's of utmost importance to keep that clean properly. Like I said, if you clean these things properly, they will last you longer. Of course, the bridge needs to be taken off the dentist once, maybe twice a year, to have a professional clean as well, but you can do a great support of that and clean your teeth regularly at home. So, of course, this is just an example. You see there are small guidance, small grooves where the interdental brushes fit. And of course, in normal situation, the denture is in place like this, screwed on top of the implants. And of course, you brush your teeth again with electrical or manual toothbrush. Like we said, upper jaw inside, lower jaw inside, upper jaw outside, lower jaw outside. And then you use the interdental brush, best with toothpaste in the upper jaw. And in the lower jaw, really go around, make sure every surface is clean and clean between every implant, like done here. And if you want, you can in this instant use an oral rinse as well. But be careful not to apply too much pressure. Yeah, thank you again for watching the fourth part of our dental hygiene series. There's one part left, and I hope you enjoyed it, and I hope to see you soon or hear you soon for the next part. Thank you very much for watching.